Is your skin uncomfortable, itching, red, or inflamed? Numerous skin disorders, such as rosacea, dyshidrotic eczema, contact dermatitis, ringworm, impetigo, pityriasis, rosea or rubra, actinic keratosis, tinea, versicolor, cellulitis, and seborrhea might be indicated by these symptoms. While certain skin disorders have established origins, such as UV exposure or genetics, others have unknown causes. Some skin disorders, such as ringworm and impetigo, are brought on by contact of your skin with a microorganism, such as a fungus or specific bacteria. These skin problems can all be managed and are typically not life-threatening, while the majority of skin disorders, at least those that aren't brought on by an infection, may never fully be treated. The majority can be managed. Today we will discuss and understand as what is ringworm, commonly referred to as tinea or dermatophytosis. What is the skin problem ringworm? Ringworm is not a worm-related condition. According to the Centers for Disease Control and Prevention, CDC, the ring in its name refers to the rash's ring-shaped appearance, which is red and irritating. It's an infectious fungal illness that lives on surfaces, clothing, bedding, towels, and other things. The CDC states that symptoms, which can include itchy, red, and cracked skin as well as hair loss occasionally, often start to show between 4 and 14 days after coming into contact with the fungus. Doctors may collect a skin sample to examine under a microscope, though they may also be able to make the diagnosis simply by looking at the patient's skin. Once ringworm has been identified, it is treated with topical antifungal creams or ointments that can be purchased without a prescription or over-the-counter. Specialist doctors advises using antifungal medications to treat more severe cases.
How ringworm spreads and treatment options. Ringworm is a fungal condition that can be bothersome, but there are effective treatment options. Contrary to its name, ringworm is actually brought on by a fungus. The rash happens to come as a ring, says various dermatologists. The term ringworm refers to the distinctive round form, which can have a reddish or scaly appearance. Tinea, followed by a word designating the location where the rash is visible, is the scientific name for ringworm, which affects different parts of the body. For example, tinea carpitis refers to an infection of the scalp. In fact, depending on how the fungus was spread, ringworm that develops in one person on one area of the body can go to another person and manifest itself on an entirely other body part. Skin-to-skin contact, clothing, or places where the fungus is present, such as in showers or locker rooms, can all result in the spread of the infection. It is more prevalent in those with weakened immune systems and is more likely to spread quickly within families or among athletes due to skin-to-skin contact or the locker room atmosphere. Children may have it on their scalp while their mothers will have it on their necks. When moms cuddle with newborns who have tinea carpitis, the mom can get it via direct inoculation to sites like her neck and chest. Ringworm treatment. While ringworm is irritating, it doesn't come with severe complications. In most cases, the rash is treated in the same way, with a topical antifungal treatment, such as Lotrimin, clotrimazole, or Lamisil, terbinafine. The one exception to the simple treatment rule is for a scalp infection, which occurs more commonly in children and is noticeable because a ring of hair loss will often occur in the infected area. Ringworm that reaches the scalp entails much more intensive treatment, typically 6 weeks of an oral antifungal medication rather than a topical cream. While it's necessary, the longer treatment course is unwelcome news to most patients, but topical creams won't work on the scalp because the surface treatments don't penetrate deeply enough. Treating it yourself with over-the-counter antifungal creams is not going to be effective because it's on the scalp.
Animals can spread ringworm to people. In contrast to several other illnesses, ringworm can also be contracted by contact with an infected animal. Even while the majority of instances won't come from unusual places, family pets are a potential source of infection because they frequently rub up against their human companions, which increases the likelihood that ringworm will spread among residents. Fungus is everywhere, claims various dermatologists. Small animals, like puppies and kittens, can contract an infection. What is the cause of the ringworm? You could assume you have ringworm because of its characteristically round look and attempt to cure it on your own using over-the-counter (OTC) medications. It typically appears as a red, scaly area where the center is clear. A trip to the doctor is advised if your self-diagnosed rash doesn't improve with over-the-counter medications because it might also resemble eczema or other skin conditions. The following are the most crucial actions for you to do when you notice an unexplained rash: quickly diagnosing it, treating it to prevent spreading it, and determining where you acquired it. How to stop ringworm from spreading. Being cautious about sharing includes being one of the fundamental precautions families may take to prevent the spread of ringworm. Make sure everyone in the family uses their own comb and brush and teach children not to wear each other's caps. Ringworm can be stopped from spreading by using other simple hygiene precautions like not sharing razors. Additionally, athletes and gym attendees should make careful to clean their equipment or refrain from sharing it. Wrestlers are among the most vulnerable populations for ringworm because they frequently come into touch with one another in damp mats that host the fungus and aid in its spread. The use of antifungal medications as part of a regular cleaning regimen may be desirable in some circumstances for wrestlers. In a high-risk sport like wrestling, consider showering right after with something that might be somewhat antifungal, shampoos as body wash. Sometimes you do everything right and you still get it. Please smash the like button now and support us by clicking the subscribe button with the bell notification. Please do share and comment your views to understand you better. Thank you. Cheers.